health officials say we are now in a pandemic of the unvaccinated, but it's really a battle for everyone. And many are comparing the COVID crisis to the HIV and AIDS crisis of the 80s and 90s. Joining me now from Washington, D.C. is David Johns. He's the executive director of the National Black Justice Coalition. Thank you for joining us, sir. I really look forward to chatting with you about this. Why do you think people are hesitant to wear masks despite the science? And can you compare it to what we saw with the HIV/AIDS pandemic with condoms?
Yes, I can. Let me first say it's good to be back. I'm happy to have this conversation with you. And I want to be clear, there are some ways in which there are lessons that we can learn from the HIV/AIDS epidemic, and there are ways in which there are significant differences. So I want to talk about both of them. The lessons that we can learn is that whenever there are tools to support our safety, to prevent transmission, we should use them. And this is the case when we think about condoms and the way in which they have always offered a layer of protection. They are, again, not a panacea. Very few things are 100% when we're talking about science and developing things like the novel coronavirus. But it is a tool, it's a resource that we know that works, and so we should use it. And one thing that has been consistent in terms of the challenges that are associated with are responsible, or that the CDC is responsible for, is a lack of clarity around communication about resources. And so one of the challenges, especially in the Black and Black, queer, trans, and non-binary community, is simply not trusting messages that come from the CDC. And a part of the distrust is because there often doesn't seem to be thoughtfulness and deliberateness with regard to messaging around things that we know work. And so there are a lot of people that I've had conversations with over the last few weeks who continue to now question why the CDC ever said we should not be using masks, when we know and when we spent months, almost a year ago at this point, talking about the importance of them. So I'll pause now, acknowledging that that was a lot, and hope that it answers the first part of your question.
Yeah, absolutely, David. So my question to you, I want to piggyback off of what you just said. Let's talk about the CDC's failure, as you said, in their communication, and how should they specifically target Black and brown communities, and maybe not target, but talk to us directly?
Yeah. And so this is an issue that always comes up when there are moments of crisis in which institutions, specifically institutions that often are oriented toward more privileged people, do not have trusted and supported leaders who are already in communication with and who are representative and members of our community. It should not be the case that the CDC or any federal institution in this country now, given the diversity that makes our country what it is, do not have individuals that are already able to have these conversations, who are already not trusted and respected by diverse communities. That is a problem. And the fact that it continues to be a problem every time there's a crisis suggests that we need to try something new in this way. Related to that, at this point, I think it's important for the CDC to supplement, to pay for the labor of individuals who occupy those positions, trusted researchers and physicians, other members of the medical community who are already in conversation with and who, again, have the trust of communities that are disproportionately impacted. And in this moment, we should be clear that the crisis is not borne equally by all members of our community. The response to the novel coronavirus has not been democratized. And so there should be a priority placed on supporting the kinds of connections, things that community navigators in the Obama Biden administration used to be responsible for, but were stripped thereafter, but supporting individuals who always do this work to be able to do it, especially in moments of crisis.
Got it. So do you not think that Dr. Anthony Fauci was enough? Because he kind of turned into everyone's short Italian uncle. We saw him so much.
For moments, right? And there are moments where your uncle is talking that good stuff and you can agree. And then there are moments where it's like, no, uncle, we gotta step this up. And in particular, I would appreciate much more clarity with regard to the communication about how they are arriving at decisions. I appreciate and welcome and support more diversity with regard to the individuals who are a part of these teams, not only working on the front end of the science, but the communication of the findings thereafter. And again, a lot more partnership with organizations that have existing relationships in communities that are often disproportionately impacted, really neglected and ignored by the interventions of or the messages of the CDC. There also is a role for big tech companies to play in this regard. Facebook, Twitter, Instagram all have a lot more that they can be doing to stop the spread of misinformation and disinformation, which could also supplement what our good uncle is trying to do as well.
Yeah, exactly. Talk more about how social media needs to play a role because, for instance, I see a lot of us, and we're just constantly in our phones. We're scrolling, we're liking, we're swiping left, we're swiping right. So talk more about how big tech companies need to step up and play more of a role in disseminating misinformation.
Yeah, I appreciate this network and in particular the invitation to have this discussion, in part because I was talking to my niece who is 18 now, going on 21 in my head. She's always going to be 16. And she helped me to appreciate that she and so many of her friends don't consume news like this. And if they do, it's because someone has taken a clip of a larger program and has shared it on a platform that makes it more easily digestible for them. And what that allows for in this era where people are receiving their news primarily via TikTok and other small digestible stories, is a proliferation of misinformation and disinformation. I'm not talking about people who have rightful concern because there are underlying conditions that they have that have not been addressed by the science. But I'm talking about people who are flat out lying about the science, who are suggesting that one might be microchipped in ways that I heard years ago when President Obama was first running. And in particular, tech companies have the ability to not only leverage artificial intelligence, but to create other firewalls such that this disinformation and misinformation is taken down, is not spreadable, at least in ways that are allowed now. And there are a lot of conversations that are happening on Capitol Hill around Section 230, which is a provision that allows tech companies to be able to moderate content. And so all of this to say that there are always connections to Congress, and we should be calling our legislators to do much more.
Absolutely. David Johns, love the conversation, love the nails. Always a pleasure having you on BNC Live. Yes.
Like you said, I appreciate you.
Always a pleasure. Thank you.